Trade unions and the Public Service Coordinating Bargain Council have rejected the Government Employees Medical Scheme's membership increase, that's GEMS. GEMS had proposed to implement a 9.8% hike this month, or rather last month in January, followed by a revised 9.5% adjustment from the 1st of April. But the unions insist public servants cannot afford this. Given the high cost of living, they're threatening to protest if the decision is not retracted. The medical scheme has over 800,000 members with more than 2.3 million beneficiaries. Dr. Stanley Muluabi is the GEMS principal officer, and he joins us now for more. Dr. Stan, appreciate the time, really appreciate it here. But, I mean, let me get down to the facts properly. So it's a 9.8% increase in member contributions from January this year, and then a further 9.5% increase in April later this year. You've already implemented a 13.4% increase last year. Why such a steep increase?
Good morning, Arabile, and good morning to the viewers of Channel 405. Can I make a correction? Because I see even in the media statement that was released, this mistake has come through. So the 9.8% increase was implemented from the 1st of January, but after consultations and engagements with the unions, the PSCBC, and a lot of these meetings happened during December, then we on an urgent basis approached the Council for Medical Scheme and requested that it be reduced to 9.5, which was to be implemented and has been implemented from the 1st of February. It is not from the 1st of April.
Okay, so there will be only one increase happening this year, and that is a 9.5% increase, and that implemented in January, correct?
No, in February, from the 1st of February, the 9.8 had to be implemented for January, because that is what was already approved by the regulator towards the end of the year. So just considering that when these engagements took place, it was already over the holiday period. We could only get the adjustment in January, and then we were allowed to implement it from the 1st of February. So 11 months, it's a 9.5. And only 1 month, which is January, 9.8% increase.
Okay, so no further increases for this year, is that correct?
No, there won't be.
But why such a steep increase nonetheless? One considers, and I know that inflation isn't always the right precursor to determine this, because that's a full basket of goods, but this figure of 9.5 itself would be more than 3 times what inflation averaged last year. Plus, you already had that 13.4% increase last year, double-digit increases. One imagines that government employees would not be able to afford this. Why such a steep increase?
It is understood, and we really are sensitive to the fact that everybody is under pressure. Family households are under pressure from a budget point of view. But it comes down to one thing. No, well, it's one thing that is really the dominant one, but there are also other factors which I shall also quickly go through. Utilization of benefits by our members are high. During 2025, we had utilization by our members, which means the claims that we had to pay. When I say utilization, I'm talking to the claims we had to pay, which were 4% above budget. Now, in GEMS terms, when we're talking, we pay claims to the 60 billion rands in claims. 1% of 60 billion rands is 600 million rands. Now, if you times that by 4, you are talking 2.4 billion rands. So we paid 2.4 billion above what was budgeted for 2025. And that is what informed the increase of 9.8, but it's not the only thing. It is the main one. The other things are the fact that in the medical schemes industry, what happens is that every year, in general, members will age by 1 year, well, subject to how many young people are joining. So then the other factors are the cost that relates to the increase of things like medicines and the technology, and a lot of new technology. And more importantly, in this category, it's drugs like oncology drugs, which are very expensive. These are new drugs that could cost one patient more than $1 million per annum. These are the factors that get into the pot that ultimately determine the increase. So it is unfortunate that we find ourselves in a situation where utilization is so high, despite all the measures that we have put in place. And one of the biggest things, and this is the last thing I'm going to say on this, in answering this question,
Sure.
we have a big problem, and we are addressing it, by the way, of fraud, waste, and abuse. I wish I could just, in 30 seconds, share with you. Last week, I received from one of the hospitals, the private hospital, they were informing me that our members, one of our members, used our medical aid for a relative. So the relative was admitted, they managed to they were not identified, and this person passed away, and now it became clear that actually it was not the main member. So that's the type of fraud we are talking about. There's a lot of other stories we can share on another day.
You know, Dr. Stan, I'm going to have to try and reject the utilization by members being high as a key issue here. It's their medical aid. It's their medical scheme. They're meant to use it. So if it's high, is that not meant to have already been factored in? Because the whole point of the medical scheme is to use it. If you need it, you're going to use it. So if that now is a problem, then why does it exist to begin with?
You are correct when you say if you need it and it is for the correct purpose, you must use it, and our commitment. And that is why we have to use the expertise of actuaries to assist us in determining how much are we going to need next year so that we cover all the costs. Yes, when you need a medical aid in that time of need when you are sick, you need to use it. And our commitment is we pay the claims. So the problem is not what you are talking about, Aravile. The problem is abusing the medical aid, using it just because you have it. You say, there are people who say, I am paying for a medical aid, I'm not sickly, I'm going to get
Dr. Stan,
yes.
hold on a second. If this is something that, now here's how I'm going to see it. If I have a vehicle that I'm paying for on a daily basis, and I travel around the country and ultimately abuse that vehicle, it is still my vehicle. I'm allowed to then use it how I see fit, within the parameters of the law, of course. Now, if you're saying that they're using it unlawfully, is that not a basis of your own policy statements and not a factor of costing?
I have to spend a bit of time with you to explain how a medical aid works. Let me briefly explain it. You have 100,000 members. Let's use 100,000 members.
Sure.
If all of them fall sick every day, you will not be able to cover the costs. Medical aid is like a stock fare. And I know we generally understand the stock fare. You pay and then you cross-subsidize those who are sick when you are not sick. Your time when you become sick, then the others pay for you. It's cost subsidization. Let me use the example of a car, but not what you have said. A car has an insurance. If you bump your car every day, you need insurance to pay for the repairs. Your insurance will ultimately actually reject and say, we can't cover you. You are uninsurable. So in a medical aid environment, those who are sick are paid for by those who are not sick. It's called cross-subsidization. Let me make an example. We have accounts that are in excess of R1 million that we pay based on the members' benefits that they are entitled to as you say. So if we pay R1 million this year for a member, and the member has contributed 5,000 rands per month, they have contributed 60,000 rands into the kitty. Where does the balance come from? It comes from the others who are cross-subsidizing that member who needs the services. If you cannot operate a medical aid on that basis, a medical aid cannot exist.
My worry, though, is that from the start, you've got one mandate, right? And I'm at the GEMS website, gems.gov.za. And in your overview, it says that the approved framework policy centered on principles of equity, efficiency, and differentiation. But the fourth point here is that It's government's commitment to an equitable and affordable medical scheme. Does that do this when you increase by double digits in 1 year and near double digits in the next?
So the increase of 9.8% that was implemented due to the need for us to cover the members' estimated cost, health cost for 2026. We annually compare how GEMS fares with comparable scheme. And Arabi, can I tell you that GEMS options, when you compare to like-for-like options, is 25% cheaper than those options that we are compared with, when you haven't included the subsidy that our members get from government. When you include the subsidy that our members get from government, we become 51% cheaper than comparable medical schemes. So we have concentrated a lot on this issue of affordability. And affordability is not necessarily how much a member pays. It is how much a specific family or the principal member has budgeted for health, for medical aid. So if you are earning 1,000 rands and you spend 800 rands, and I'm being very extreme here, you spend 800 rands of your 1,000 rand that you earn on your transport cost by buying an expensive vehicle, you are going to be under pressure for your medical costs and other costs. So affordability is also how you manage your own costs. So we are very sensitive to the fact that households and our members, public service employees, are under pressure economically. But it does not mean that now we have a situation where we have to ensure that we cover their health costs, which have escalated over the past year. And this is the reason why we have this 9.8%. But the last thing I'd love to say is that today I am sitting at a venue where we were supposed to be having a meeting for the whole day with labor, organized labor, so that we start looking at these things, so that we avoid the same thing by the end of 2026.
I think,
a week ago, unfortunately,
Dr. Stan, and I think a lot of people might actually say to you, if you had possibly engaged with them from the start, before making this increase, to have said to people, listen, this is the situation we're facing. For an extended period of time, we want to engage with you, but I want you to know that unfortunately, because the price of oncology is increasing, because of the high usage, high utility, and even if it's maybe because of the health risk profile of each person has now increased because of how much they're utilizing their medical aid, we're going to have to increase prices by this to try and keep this affordable, but to also be able to manage and give you everything. And I think if we had the right communication from the start, maybe that would have been key.
So may I inform you that we engage with the PSCBC on a quarterly basis, and that is a standing arrangement. There are quarterly meetings of a working group where we start.
But that's why they're striking then.
In the first quarter. But can I please finish? So unfortunately, we have had instances where meetings are cancelled this past year, but we started informing when we managed to set up a meeting in September 2020. We had already tried in the prior quarters. We are required to meet on a quarterly basis so that we engage on these issues. Some of those meetings are cancelled for various reasons. I won't get into those now, but I want to inform you that every effort, in fact, standing arrangement, that we engage with the PSCBC, because PSCBC represents the majority of our members through the organized labor in the public sector. So we engage with them. But it is not true that we don't.
No, and I'm not saying that you don't. I'm saying, was it the right communication to get them there? And if that is the case, you're then doing it despite having communicated with them and them rejecting it clearly, because that's why they're still striking. They must have been striking because they rejected. And then you go on and still increase nonetheless. That doesn't make it let's say, a fair government way to do things, surely one would think.
If I broke the law as the accounting officer of GEMS, I would be sitting here and taking an interview on why I broke the law. Can I explain to you that by the 1st of October, we are required by the Medical Schemes Act to submit our business plan and increases for the following year. You cannot not submit those unless you have an exemption. and an exemption process takes from the Act takes about 3 months. So this is part of, we do it every year by the October most of the time, the 1st of October. We are required to submit to the Council for Medical Schemes the increases for the following year. And it's also a requirement that before the end of the year, we inform our members after councils has approved that increase. So we do that. Ideally, we'd love to do it in November, but because we don't get the final approvals, usually we get them early in December, but then we inform our members during December. All of these things are the fact that we have to comply with the law.
Yeah. Dr. Stanley, unfortunately, that is all the time we have, but I really appreciate your candor, and I appreciate the honesty in having this conversation. Let's have a sit down, why don't we? Let's thrash this out face to face. It would be really great. Appreciate your time, though. Dr. Stanley Molowabi is the GEMS Principal Officer.